one or two protocols with us, and then we'll give room for questions. I'll be done in like 20 minutes. You can give you time to ask questions related to the topic and not related to the topic. Sorry. I'm at home, so I'm a bit getting rid of distraction. Okay, so the outline basically, we'll start by trying to, what is COVID-19? Basic information on how it's contacted, signs and symptoms, then COVID-19 protocols in newborn baby, how to prevent COVID, and then briefly on child immunization, which I'm sure we know about already, just to buttress one or two things about immunizations. So if you can't hear me clearly, just let me know so I can, either talk slowly or, so I can, or more audibly so you can hear me. So basically, what is COVID-19? It's actually caused, is a viral infection, and it's caused by severe acute respiratory syndrome coronavirus, which is also known as SARS-CoV-2. We all know that it was discovered in China last 2019, and since then it has spread throughout the world. And right now it's been declared as a global pandemic because there are over 44 million confirmed cases as of recent statistics, and 1.1 million deaths have been reported globally. Then we want to ask, how is it contacted? Of course, we all know the basic ways COVID-19 is contacted. If I should ask one or two people how COVID-19 can be contracted, it's supposed to be an interactive session. So who knows how we can get COVID-19? Does anyone have any idea or wants to make any suggestion? Okay, anyone can say anything. There's no wrong answer. Okay, no one wants to contribute.
Doctor, maybe you should continue, and towards the end you can continue.
Okay, all right. So basically, it's can be contacted. It's highly infectious, and the major means of transmission are droplet infections or contact.
You should continue, and then you can contribute towards the end.
Someone's phone is ringing. Okay. All right. So it's highly infectious virus, a viral infection, and the main ways of transmission are what we call droplet infections, and that's respiratory secretions, which from direct contact, from someone who has coronavirus that is maybe talking, coughing, sneezing, and when you are at close proximity with the person, let's say within about 6 feet with the person who has coronavirus, and droplet infection from coughing, from talking, from speaking. Those are the things, those are the ways it can, be gotten. Or aerosols. Aerosols are also droplets that are suspended in the air. That's are ways that one can actually contact coronavirus, or from surfaces. Sometimes droplets rest on surfaces, maybe the table, the chairs, and then direct contact with those secretions too. And now using those infected hands to touch the eyes, the mouth, or the nose are ways in which one can get the COVID-19 virus. And it can remain viable on surfaces for hours to days. Okay, so some people have seen that some objects or some surfaces can be there for as much as 72 hours or some kind of surfaces. And it's more common through respiratory, when droplets, when you cough or you sneeze or you speak, those droplets can, be suspended in the air, and someone can breathe in those droplets. That's one of the common ways in which it can be transmitted. Okay. Now, basically, there's limited data. It's a new virus, so it's still being under investigation. But so far, there's been little or no data to confirm that the mother can pass COVID-19 to the fetus during pregnancy. So if your mother has COVID-19, can it be passed in utero as during pregnancy? There's limited data of that so far. So they are really saying that for now, there's really no evidence that it can be gotten when the mother is pregnant, from the mother to baby during pregnancy. And to date, COVID-19 has not been seen in breast milk. So some studies have been done to see if COVID-19 can be traced in the breast milk, and up until now, there is no evidence that COVID-19 can be transmitted via breastfeeding from the mother to the infant. Now, what are the symptoms of coronavirus? I'll just run through some of the basic symptoms of coronavirus, how it can present. Now, the most common symptoms we see are fever, dry cough, or someone can be very tired. So someone can come with fever, as high temperature, chills, rigors, shaking, or could have dry cough that's not resolving with common antibiotics, or the person can be unduly tired. Other ways it can present could be aches and pains. Some could have sore throats. So can even come in with abdominal symptoms like diarrhea and vomiting. These are ways that one can present with coronavirus. Other things could be the more severe symptoms could be things like other things could also be headache. So they could have loss of smell. So one of the common ways to present are they lose their sense of smell. They're unable to smell things, or they lose their sense of taste. That's one of the common ways people can also present coronavirus. Others could be conjunctivitis. So you can see that some people could have, this is a viral infection. So the eyes could be red. So we call conjunctivitis. Or they could have a skin rash. So you can see that coronavirus presents in different ways. People can just cough and catarrh, or it can be diarrhea, they can be vomiting, loss of smell, even the eyes, you can be having a skin rash. These are some of the common ways, the ways in which you can present. But the severe symptoms are when there's difficulty in breathing, which is the classical one that most people know is coronavirus. The person would have difficulty in breathing, working hard to breathe, fast breathing. It can be chest pain or chest tightness, like someone who's having an asthmatic attack. And then some can also lose their speech. These are the serious symptoms. And these people that have this kind of severe symptoms are the ones that actually qualify for hospital admission. Now, I want to come down to COVID-19 in the newborn, because most people are wondering what's the protocol of managing a newborn with COVID-19, or a mother that has COVID-19 that has a newborn. So there are different protocols or ways in which you look at managing COVID-19 in the newborn. Now, transmission of the virus that causes COVID-19 is, as I said, it's thought to happen through respiratory droplets and can happen during the during the postnatal period. So I mentioned earlier that the transmission rate in the womb is minimal or not even seen. But the mother can get the baby coronavirus when the mother is exposed, the baby is exposed to a mother who already has the infection. These are the ways that the baby can get. So when the mother is coughing, talking, speaking, and the mother is infected, she can actually infect her neonate, or a caregiver can infect a neonate with coronavirus when they have active symptoms. But there's limited reports on, as I mentioned earlier, about transmission during pregnancy. And of course, we are still trying to see that, but as of now, the transmission from mother to baby in the womb still remains very, very minimal. Now, what are the common signs among babies? About the same signs we see in adults. Baby can be having fever, can be weak, they can be cough, fast breathing. Children may have poor feeding or not feeding as well as they are supposed to be feeding, can have difficulty in breathing, and have diarrhea or other symptoms too. And then basically, I've seen that very few neonates have, from the studies of coronavirus in the last few years, just few neonates have had coronavirus infections. And among those that have, most of them do not have symptoms at all. That's they call them asymptomatic, or some of them have very mild symptoms and do not require any form of support. Most of them do tend to recover. So fortunately, in the pediatric population, you've not seen so many severe cases in children, and then infections in neonates are not as common as that of the adult population. And most of them, as I said, are usually without any symptoms or very mild symptoms. Okay. Those that have severe illnesses usually will require some form of ventilation, that is some form of respiratory support. But these neonates are those that are usually children that have medical condition, children that maybe have a heart condition, or maybe those who are premature are the ones that are at risk of having severe COVID-19 illness. So those are the ones that are usually more prone to having severe infection. But most times in neonates, the infection is usually uncommon or really very mild from the data that has been seen over the past few years. So we usually recommend testing for every neonate who is born to a mother that has confirmed or suspected coronavirus infection. We always advocate that once any mother is known to have coronavirus infection or is being suspected, the neonate should be tested, okay, to see if the child has the infection or not. And protocols are that when a child is born to a mother with coronavirus, the testing should be done about 24 hours or at least 48 hours after birth to see if the child has COVID-19 or not. For those without symptoms, you can do the test within 24 to 48 hours. If the child is okay, then the child can now be discharged home and then followed up on outpatient basis. Now, I mentioned that all neonates who are born to mothers with suspected coronavirus infection should have a test done and or should be considered to have suspected COVID-19. So if for instance we're unable to do a test for the child, every neonate born to a mother with suspected coronavirus infection should be considered to have COVID-19 infection until you're able to do your test to actually say that okay, this child does not have coronavirus infection. Now, basically, what we say is that when the mother has coronavirus infection and her child also is coronavirus positive, they should not be not other mothers who are healthy. So they should be separated together and put in a different room from other people because of the risk of infecting other mothers who are actually not coronavirus positive. And then you should adhere to infection prevention and control practices, which we usually carry out during normal healthcare delivery. So basically, what do we do what are the protocols we carry out for someone who is COVID-19 positive? So we said basically we encourage early and close contact between the mother and the neonate, because early and close contact between mother and neonate establishes breastfeeding and establishes bonding. And current evidence suggests that the risk of a neonate acquiring COVID-19 from the mother is very low. So we usually see that most times, when the mother is even coronavirus positive, we not separate the mother from the baby initially, okay, because the risk of acquiring coronavirus from the mother is usually very low. And it also says that there's no difference in the risk of infection from a neonate that is same with the mother and those who are cared for in a separate room. So the risk of infecting a baby, whether the baby is the mother or not, the risk seems to still be low either which way. Now, when there's the potential risk of coronavirus infection to the baby, if the mother has coronavirus and has confirmed infection, there are things the mother should do to prevent infection to the baby, such as wearing face mask, practicing hand hygiene while caring for a neonate. So we always insist that, if the mother has symptoms, you can, and the mother wants to stay with the baby, of course you can still do that, but you must have infection prevention and control measures, which are very important. So always wear a face mask for touching the baby. Always wash your hands before and while caring for a neonate if mother has suspected coronavirus infections. And mothers with suspected coronavirus infections, some mothers, so there are different criteria, as I said earlier on. Not everybody is going to be known at risk. There are some mothers that have some particular things that is okay. If mother has so and so, mother is not at risk of infecting her baby. So if a mother has at least 10 days have passed before the symptoms have appeared, then the mother cannot infect the baby. So if for instance, the mother has had the symptoms for at least 10 days before the onset of the or 10 days have passed and there's no more symptom, mother can not have it without being scared of infecting her child. Or if the mother has been severely ill and up to 20 days have passed, then the mother is not at risk of infecting her baby, so the baby can not be the mother. Then if at least 24 hours have passed and the mother who is coronavirus positive does not have a fever and not using anything like paracetamol, for instance, and no longer on any drug to control fever, then there's no more fever in 24 hours, and the mother is not at risk of infecting her baby. Or if the mother other symptoms like maybe diarrhea, vomiting, and other symptoms has subsided, then the mother is not at risk of infecting her child. So for those mothers who are very sick, for instance, those who are very ill, those who need ventilator, or those who are respiratory support, those are the ones that may not be with their baby because they are very, very sick at the initial period. So those are the ones that who are too sick to care for their babies may need to be separated for their child for that level of time when they are very ill. And when the mothers get better and there are no more symptoms, the child can now be nursed with the baby. Now, also, if the baby is at high risk, for instance, those who are preterm babies that have a medical condition like maybe a heart disease or a chronic lung illness, or babies that require a ventilator, those are the ones that may not be nursed with their mothers or may require separation from their mothers to nurse the babies for a period of time. But I'm trying to portray the fact that coronavirus infection from mothers to neonates is actually low. And then if the mother has coronavirus infection, the baby can still be nursed with the mother. And I mentioned some criteria. If the mother is asymptomatic, doesn't have any symptoms, mother has not had fever in 24 hours, mother has had at least 10 days and has a symptom for about 10 days or so, then the baby can be nursed with the mother without any risk of infecting the baby or causing the child to have coronavirus infection. Now, I said, so separation to reduce the risk of coronavirus infection is not necessary when the mother and her baby are both positive. So when they are both positive, there's no need to separate the mother and baby since they both have the coronavirus, just for the mother to also adhere to every guideline, such as hand washing regularly, use of face masks regularly. So when they are both positive, then there's no need to separate the baby and the mother. You can keep them together, but mother should still all the same try to adhere to different guidelines of hand washing, use of face masks to prevent further infection or to prevent her from further getting any infection with coronavirus. Now, as I said earlier, how do we reduce the risk of transmission, which is what I'm still trying to buttress. I see most cases, when the mother, when the unit is to remain with the mother in the same room, and I mentioned earlier, different things can be used to minimize the risk of coronavirus infection from the mother to her child. So when the mother has a suspected coronavirus case or confirmed case, I mentioned earlier, I'm trying to emphasize this fact that mothers should wear a face mask and practice hand hygiene. Even when we have people coming in to visit our children, as I see in hospitals most times, you see that all your visitors put on a face mask because you don't know who is carrying coronavirus infection. Most people do not have symptoms. So when people come to greet you from outside, please, I always ask your visitors to put on a face mask. Because as I said, you don't know who has coronavirus. Not everybody manifests symptoms. So everyone caring for a child with who is suspected of having it or a confirmed case must always wear a mask around the child and practice hand hygiene at all times. Please, we do not use face masks and shields in neonates. So you cannot use a face mask for a baby. You cannot use face mask for a child who is less than 2 years of age because there's a risk of suffocation. So if you have a neonate and you want to protect the child, you don't wear face masks for babies. You don't wear face masks for children who are less than 2 years of age. But the very high risk that these children can actually suffocate. So that's one of the ways in which we prevent contact. The caregiver can wear the face mask and try to maintain basic hygiene and all that, but not to wear face mask or any form of face shield for a neonate or a baby. Then also, if where there's need or where the child is where there's high risk, there can be physical distancing between the mother and the neonate, especially when she's not the one that is caring for the child directly. So they can be physical distancing, and if the mother is not the one who is nursing the child, so try to maintain at least 6 feet between the baby and the mother. Or if the child is an incubator or being nursed in hospital, the mother should try to maintain her distance from the child if the mother is really infectious or having an active infection. Then if the mother is too sick to nurse her child, then a healthy caregiver who could be a nurse or a healthcare worker who is not at risk or who has little risk should actually take care of the child, and also appropriate prevention should also be carried out, and appropriate caution like wearing a face mask and hand hygiene for those who are providing care for the neonates. I mentioned also that coronavirus infection in breast milk is really very small. So maybe mothers who have COVID-19 can still go ahead and give their children breast milk because the transmission in breast milk has not been seen at all. So basically, in summary, what's the prevention of coronavirus? How do we prevent coronavirus? I think that's the main thing I'm trying to talk about today. Beyond just what happens when your mother has it, how do we prevent coronavirus? People say that prevention is better than cure, and I always want to emphasize on what we can do to prevent ourselves from getting COVID-19 during pregnancy. And when we prevent it, then there'll be no need to talk about having COVID-19 pregnancy and then giving our children COVID-19 virus. So how do we prevent COVID-19? To prevent infection and social transmission, of course, what we always insist, washing your hands regularly with soap and water, and an alcohol-based sanitizer, which has about 60% alcohol in the sanitizer. So washing your hands, I usually say washing your hands is actually the way we usually wash hands in hospital. I wish I could do a video to have shown you how to wash our hands, but the trick I usually use, you can sing this song, the song, Happy Birthday to You. You can sing it like 2 times as you're washing your hands, at least for about 2 to 3 minutes. You wash your hands properly. You wash in between your hands. You wash your thumb, okay? You wash the back of your hands. You wash your knuckles and then you rinse. So at least 2 times. If you cannot remember to sleep for 2 minutes, I think this song, Happy Birthday to You, 2 times. As you're singing the song and doing it twice, you wash your hand at least for at least 2 to 3 minutes. So ensure that every corner of your hand has been washed properly. And then when you cannot wash your hands, always use an alcohol-based hand rub. I encourage people to carry sanitizers in their bags. Whenever you cannot make use of a wash hand basin to wash your hands, always try to get like soap and water to be able to wash your hands with. Then maintain at least 6 feet between someone who is coughing or sneezing. And for those who are coughing, please try to cover your mouth with the crook of your elbow while coughing, not into your hands, while coughing to the crook of your elbow, and try to maintain a distance from someone who is coughing, at least 6 feet from people who are coughing. Other ways to prevent is also avoid touching your face. And for women, it's really hard not to touch your face. You always go to maybe adjust your weave on, adjust your hair or something. But if possible, when you're outside, try not to touch your face. If possible, do not take your hands to your face. Check your hands are not clean. There's also, I mentioned, cover your mouth and nose when coughing or when sneezing. It's also very important so that you do not infect others, especially if you have some symptoms of coronavirus. These days, most symptoms of coronavirus present like your normal malaria, normal cough and catarrh. So most times you may not know you have COVID-19 until you go for a test and say, okay, wow, I'm actually positive. So when you're outside, when you're coughing, please try to cover your hands and nose when coughing. Then if you're not feeling well, you can stay home. Instead of going out in the public and probably also, infecting others. If you're not feeling well, take a sick excuse with you and then also stay home. Then also for those that smoke, you should also try and refrain from smoking. That can also weaken the immune system. Then practice physical distancing by avoiding unnecessary travel. So if you don't need to travel to your village, you don't need to travel to see anybody, you can suspend travels while pregnant or if it's not necessary. And then staying away from large groups of people. So it's not the best time for, even as a pregnant woman, it's not the best time to go for parties and not necessary. So physical distancing is also very important. Staying away from large gatherings also, using of a face mask and then basic hand hygiene. So what I wanted to buttress in COVID-19 infection basically is that the risk in the, so far we've seen minimal units with COVID-19 infection. COVID-19 infection, I'm just trying to summarize what I've talked about so far. COVID-19 infection has not been seen to be transmitted in the womb from mother to baby. There's been no data to support that mothers can give COVID-19 to children in the womb, but it can be transmitted from mother to baby after delivery. But there are some measures that can be carried out to ensure that the mother doesn't give her child COVID-19 infection, such as maintaining hand hygiene, using of a face mask, ensuring that, if the mother is highly infectious, the mother is very ill, or requiring ventilator, child can be taken from the mother till the mother gets better. But the mother is, is well, the mother has not had fever in 24 hours, the mother has not had symptoms in some time, or symptoms have disappeared, and the mother is not as much at risk as giving the baby infection. But meanwhile, all infection protocols should be taken to avoid transmission from the mother to the baby. So these are things I'm trying to buttress that is important to understand. And then also that mothers who have COVID-19 can still breastfeed. There's minimal, they've not seen any COVID-19 in breast milk, so they can still supply a baby breast milk even if they have coronavirus. Okay, so briefly, I want to just talk about immunization. I knew that we know about immunization. I just decided to put up a chat so that we can just discuss about immunization in babies. Immunization basically helps to improve the child's immunity and also to help the child to resist infections. This is a picture of the immunization schedule done here in Nigeria. We usually do immunizations at different times in the child's life. We start at birth, 6 weeks, 10 weeks, 14 weeks. Then we now do some at about 6 months, 9 months, 12 months, and as the case may go. And then what the aim of immunization actually is to be able to, try to build the child's immunity to fight certain infections that are common here in this part of our country. So things like poliovirus to prevent polio, BCG to prevent tuberculosis. And it's actually very important that children receive immunizations, okay? Now, if you ask me, can a child be immunized for COVID-19? As of now, we're not giving COVID-19 immunizations to children now because some tests still need to be done on the vaccine. But can breastfeeding mothers take COVID-19 vaccine? Yes, you can actually. It has also been shown that mothers who are lactating that take COVID-19 vaccine can actually transfer some immunity to their children while breastfeeding. So it's safe for lactating mothers. But for children, for now, we are still testing the possibility of giving children the vaccine. So for now, kids are not being vaccinated with COVID-19 virus, but mothers who are breastfeeding can actually take it safely and can pass some antibodies to their babies via breastfeeding. So basically, as I mentioned, immunization is done at different times during a child's life. And then the reasons are to prevent commonly acquired infections that can be, life-threatening. Thank God for the onset of vaccines. Some 50 years ago, things like tuberculosis was a killer. Things like polio was killing and was something that was so major. But because of vaccines now, we're able to, reduce the effects of these things. So that we hardly see any child that has polio anymore. We hardly see people that have things like pertussis, whooping cough, where the child will cough so much, the eyes will be red, the child will be very sick, coughing and coughing. So these are the importances of immunizations. And then, like I said, there are different schedules, there are different reasons why, different immunizations are given at different points of a child's life. So once you come from immunization, beyond just coming, what we do is that when you come from immunization, we educate you, we counsel you. Then we also try to explain what the immunizations are for. possible side effects that could be seen with immunizations, and then, when next to come back and all that. Okay. So I don't know if you have questions. I like to give room for questions. I want it to be very, very brief sessions so I don't take our time so much. So I'll pause now for questions. If you want me to go back and talk about something, I can go back again, and then we address whatever concerns you want, or any questions you have to ask. Hope I wasn't too fast. Thank you for listening. Okay.
Thank you very much, Doctor. This is Dr. Bankole.
Okay. Yes, sir.
Can you hear me?
I can hear you, sir.
Not too fast, because I can hear you very well today, because I know wearing face mask.
I'm glad, sir.
Thank you very much. I want to add something to that's very to re-emphasize something, and also to add and then ask one question. So I have one emphasis to give, add something, and then ask one question. I will start with the question, which has been asked before. Can pregnant women take COVID-19 vaccination? That's the question. Okay, the emphasis I want to give here, because I've been asked before, and I'm happy that you actually mentioned it, is that it is not appropriate to wear either face shield or face mask for babies and for children under 2 years. That is very important. People have asked me that question again and again, and I'm happy that you have mentioned it. So what am I trying to add? Is on vaccination. This question has been asked again and again. Now, the truth of the matter is that vaccination produces active immunity. Now, we do not want to wait for the child to get exposed to the infection for the first time without getting prepared. What most vaccines do is to sensitize the baby or the child's body in readiness for the invasion of any of these bacteria or infection or viruses. So that once the immunization is given, the body immune system will be sensitized. They'll have memory cells that will have taken memory of the fact that this body has seen this before, this type of infection before, and will be ready to go into action if in future that same infection now invades the body system of the baby. Therefore, it is possible for someone who has had immunization to have the infection, but the infection will not overwhelm the child. So some people have asked me, and they think that it's because of the failure of the hospital or the health center, that they had the child immunized for measles, and then the child came back again sometime in their life with a measles infection. That measles infection will not be overwhelming because the body immune system will fight. If it does not fight it completely, that's why the infection will manifest a few times. So by and large, it is profitable for all of us to ensure that we cover our children for this common infection so that the body or the baby and the system will not be surprised or overwhelmed when that infection eventually comes. No cannot predict what will happen. A child goes into the community, there are a lot of viruses in the air, a lot of bacteria. When they touch their mouth, they contact people and all that. So they should be prepared for the future. And sometimes we wonder why and what happens when the child is immunized and the child is feeling sick. Now, the child can feel sick because we are introducing a foreign body into the system, and the body system can react to that and feel sick with mild fever, can become irritable and all that. More often than not, those things will be very brief. But anytime it becomes more severe than just a brief complaint, please come back to the hospital to complain to the doctor. That is my contribution, that's my emphasis, and also my question. So you can answer my question now.
Okay, thank you so much.
Can we give COVID-19 vaccine to pregnant women.
Pregnant women. So thank you, sir, for your quest, for the contributions. Very, very important, stressing about immunizations. And as I mentioned,
So we can.
Sorry, can you hear me? Okay, so I was saying, so stressing, just to buttress what Dr. Bankole just mentioned to you about immunization is very important, extremely important, so that you can build the child's immunity. Therefore, COVID-19 immunization, so there are different things that are being studied right now. Currently in Nigeria, we are not routinely giving pregnant women, but like I said, there are some studies that are showing that pregnant women can actually get the vaccine. I have to do some research and check myself. So they are saying that, but before you give the vaccine, you have to weigh the risk against the benefits and talk to your obstetrician to determine if it's really necessary at that point in time. But some people are beginning to give, but here in Nigeria, not routinely giving pregnant women just yet. But I said, it's something that we need to discuss and look at the risk versus benefits of the vaccine before wanting to give. But some people actually said giving pregnant women COVID-19 vaccine outside the country. Yes, some people have been giving, but there has to be a strong indication most times. Because truth is that the vaccine is still being studied. So the risk of giving a mother and what happens to the baby has not been studied fully yet. We cannot tell the effect on the baby until we look at it later. So that's why I'm saying that it's a bit dicey. We're not totally going to say yes to get the vaccine. But if you look at the benefit, is it really very necessary at that point in time? If it becomes expedient, then you can talk to your gynecologist and say, okay, yes, let's measure the risk and the benefit and see if you can give the vaccine. But routinely, we're not giving every pregnant woman vaccine. I mentioned that women who are breastfeeding can take the vaccine so you can protect your babies by passive immunity through your antibodies as you breastfeed. But for pregnant women, it's still not a let's say like a consensus yet about it. But some are giving, but there has to be a clear-cut reason as to why. Because studies have not yet come out as to the risk of these vaccines on the unborn child. So that may come out over time. I don't think anyone would want to use her child as an experiment. Did that answer your question?
Yeah, the question is answered. Thank you.
Yes. Okay. Do you have any more questions? Okay, any more questions? I guess we all know about COVID-19, a very common topic right now. We all know about coronavirus. So there are no more questions.
Yeah. Thank you, doctor.
Thank you, doctor.
Yes, ma'am.
Thank you. Thank you.
I hope you're able to take anything away today. Understand that COVID-19 infection is still very much around. It hasn't disappeared, and I should also try to take extra precaution while I'm moving around in society. Please avoid large gatherings, especially when you're pregnant. Try and also avoid, try to practice hand hygiene, covering your face, covering your mouth, and then also ensure that, as I said earlier, you don't wear face masks for babies less than 2 years of age. And if you have any symptoms, just come to the hospital. Let us investigate and test you to know exactly what is wrong. Do not self-medicate, especially when you're pregnant. And try to be as careful as possible as you can.
Thank you very much, doctor.
I hope to meet most of you.
Someone dropped a question in the chat.
Okay.
About liver. If it's true that a pregnant woman should not eat liver.
Should not eat what?
Liver.
Liver.
Yeah.
Well, no. I don't know about. I've not heard about pregnant women not eating liver. Just eat healthy. There's no contraindication to any food, unless you have allergies. You can eat liver. You can eat meat. You can eat chicken. You can eat whatever is healthy for you in pregnancy. There's nothing about pregnant women not eating. So you can eat whatever works, whatever is healthy for you. But I also encourage you to make sure you have like a balanced diet. Make sure you eat fruits, eat vegetables, eat healthy foods. Don't snack on junk so that you avoid, complications, having a very obese child. But eat healthy. There's no connection to liver pregnancy.
I want you to please emphasize this because we have this challenge when patients are on admission. Our culture requires that when someone has just delivered, almost everybody in the family wants to carry the baby.
Yes.
I think it's good to emphasize that in this time of COVID, we need to be circumspect. We should be very careful because we don't know who is coming. You have said it before. I want to emphasize this. Don't know who is carrying the baby. It doesn't mean that the person who is carrying the baby does not have COVID because he's not coughing. So I think we should be restrictive. We should be careful because we imagine that if you come to the hospital and we have problem controlling the crowd, we imagine what will be when you get home. So I think this information is very, very important. Let them hear from you, the pediatrician, because I'm a bloody surgeon.
I actually mentioned it earlier that, you know, when that's one thing that, we usually kick against that. Please, you know, your relatives love you, but you don't know who is carrying COVID. And that's what happens with COVID, coronavirus. We let our guard down when we are around our friends and family. But most people that are having coronavirus do not have any symptoms whatsoever. So they don't all need to come and visit you. They really love you. They can see you via Zoom, see you via WhatsApp video. Thank God for social media. There are many ways of seeing your baby without coming in contact with your child. But for the first few months, that child's immunity is really very low. And those trying to contact coronavirus, it can be deadly in them if they contact it from us. So we always insist that please, not everybody comes to see the child. Not everybody must come and visit your child in that initial period. You can ask them to hold on, just wait. They can see your child on TV, Zoom, can see your child on WhatsApp. You know, not everybody must come and visit you at that point in time because most people that carry coronavirus do not have any symptoms whatsoever. Okay, so you want to avoid, and if they're going to insist that they must wear their face mask, even if it's your mother, she must wear her face mask, please, and wash her hands and sanitize at each point in time, because it will be nice for you to go through 9 months of pregnancy and then have the child come down with COVID-19 infection. That won't be nice. So please, also in hospitals, not everybody must come and preach in hospital. Hospital is also a high-risk environment where we are working with people that who knows who is carrying what in hospital. So not everybody must come to the hospital to see you in the hospital. We don't want the whole village coming to say hello to you. They really love you so much. They can say hello to you on phone and come later when the child is bigger and when all your visitors must wear. Please, when they tell them nicely, they must wear face masks. Can provide hand wash in front of your house, provide face masks for them. They don't have. So once you insist, they'll get angry, they'll frown, but they'll get used to you. Okay? Because you're trying to protect your baby. Okay? This is very important. Okay. So if there are no more questions for now. Are we still here? Or we've all gone?
Yeah, here.
Yeah.
Okay.
Yeah, yeah. So we should not do naming ceremony.
Sorry?
That means we should not do naming ceremony.
I didn't hear you. Okay.
I said that means we should do naming ceremony.
Oh, you can't do a naming ceremony, but we can do Zoom meeting. Just a few family members can be around. They should all wear face mask, social distance, and then the rest can join you via Zoom. You don't have to call the whole crowd for now. Things are no longer the way they used to be, so we have to move with the trend. It's our new normal now. So minimal crowd, social distancing. When the child gets coronavirus, when the child gets older, they can all come and see. So I'm not saying you shouldn't do a naming ceremony, but you mustn't have a crowd at this point in time. They can send their gifts, you know. Less money spent on food now. So that's cutting costs for us, isn't it? So like you can do just small gathering, close family, but they all should wear face masks, social distance. Not everybody should carry your child. You don't have to carry your child, but COVID or no COVID, that child's immunity is low. Not everybody can carry a newborn baby. It's not right because you don't know who is carrying what. Young coronavirus, they can be carrying some other disease that you're not sure of. So not everybody must carry the baby or see the baby for the child's own protection.
All right, thank you.
All right, now. Okay, so thank you for giving me a few minutes of your Saturday. I hope you are doing well, taking your drugs and then resting well. I hope to see you very soon. At least I'll take care of your babies hopefully in the next few months. So then I wish you a lovely pregnancy and safe delivery when the time comes. Okay.
Thank you. We have another question.
Okay.
Sorry, if it is safe to take lemongrass tea during pregnancy.
So I'm sorry, I'm moving. I'm just trying to get a charger. Don't be offended. I'm listening. Lemongrass tea. I haven't seen anything adverse about lemongrass tea. It's natural. But you know, for everything you take, it should not be in excess.
Okay,
You know, why are you taking lemongrass tea? What is it for?
Okay, can the person that dropped that please answer the lemongrass? And then somebody else said pineapple and pawpaw, but I think we've said that before. If it's safe to eat pineapple and pawpaw.
Sorry. Okay, pineapple and pawpaw are safe. Fruits are healthy. But I'm just wondering what lemongrass tea is being taken for. I'm just curious, what's lemongrass tea what's it been taken for? Can the person please answer? As I said, I'm not saying anything adverse about lemongrass tea, but anything you're taking, even ginger. So even ginger should be taken in moderation, because anything taken in excess is not good. So even your ginger should not be your normal herbs, spices. Take in moderation, because ginger taken in excess can also cause issues too, from heartburn to other issues if taken in excess. Anything you're going to take in moderation. What we do not advise are things like alcohol, cigarettes in pregnancy. We don't advise you taking things like over-the-counter medication. So when you're pregnant, you can't take any medication, because some medications are not safe for the baby. And some drugs that have been taken for vomiting in the 1970s that used to cause the children to come out with half a hand, half a leg. It was called thalidomide. So for any medication, what we advise, once you're pregnant, any drug you want to take, consult your doctor for your medication. Not when you can go and just say, give me Actifed and I want to take a half cold, or give me Pro-Cold. Every medication you take, ask your doctor, is this medication safe? Even your ibuprofen that you take for pain, you need to know when to take it and when not to take. Because ibuprofen taking excess can cause issues for your baby too. So for things like lemongrass, they're natural things like ginger, but everything should be taken in moderation, because taking it in excess can also have issues too. But I don't know why a person is taking lemongrass tea. I would have loved to know why. Is it for supplement or just for, I don't know, healthy reasons? You know, I wanted to know why taking lemongrass tea. Just wondering.
She said she's only taking it as tea from the message dropped.
Yes. Okay. Sorry, I'm just trying to go back to trying to go back to it's I'm taking in moderation, but not excess, just a little of it. But what I'm emphasizing is that once you're pregnant, try to eat healthy. I know there's people have cravings, some crave some crave funny things, but when all your cravings, try to make sure there's a balance between fruits, between vegetables, between carbohydrates, protein, because you need all those to help your baby to grow and for you to also be healthy in pregnancy. So everything should be taken in moderation, even your ginger and all that, at least to you. Dr. Kile wants to say something.
Thank you, Doctor, for your presentation. Good stuff. The answers to the questions on the tea, the pineapple, the pawpaw are what obviously I've been telling patients who ask this same question, that they are being told by their friends or by their mothers, do not take pineapple. Though I do tell them that taking pineapple in excess may cause increased bowel movement leading to diarrhea. And usually when you do have diarrhea, because the uterus is very close to the rectum where the feces will pass out, so increasing movement of the rectum, of the anus area, will cause obviously may cause some contractions of the uterus, so which we do not want. And it is this same mechanism that people take some oil to try to facilitate labor, hoping that those oil will lead to diarrhea and irritate the uterus enough for contractions and labor to happen. So taking your pineapple, your pawpaw in moderation will have no deleterious effect on the baby. So the answers are spot on. And the lemongrass, I guess, because I've taken lemongrass before, it's just being used as a tea. Nothing special about it. So it's natural. Taken in moderation is safe for the baby and the mother.
Yeah.
Thank you.
Thank you, doctors. Thank you.
Yeah, okay. So I said everything should be taken in moderation, okay? Not excess of anything is not good. So everything should be taken in moderation. It's fine. Okay.
I'm
So
sorry, I have one more question.
All right.
I forgot. When is a good time to embark on maternity leave? To proceed.
Okay. So well, that's we depend on the person. But if I were to advise, maybe Dr. Kile will still contribute. Sorry about that. So for me, I'll advise you to take a few weeks or a week before your maternity leave, because you need to rest. Pregnancy is a bit stressful on the body and even on your psyche. So you need some time to rest, some time to get yourself together. It would be nice to rush from work straight to delivery. So if you could take a few weeks off, maybe like 2-3 weeks for your expected time of delivery, but because babies come, you have an EDD. We have two plus or minus 2 weeks, so you can't take that when the baby will come, but it's a time frame we give. You can take a few weeks before your expected date of delivery, so you can actually rest, prepare yourself for pregnancy. Because pregnancy is also, you have to be psychologically ready, for it. So don't just rush off. Take a bit of time, maybe like 2-3 weeks off before, you go to before you give birth, to give your body some rest, to slow down. Lagos can be very stressful, work. Even if you're not working, it can be stressful. So that's a little break before pregnancy. I think it's individualized really, but if you were to ask me, I'll say a few weeks before you give birth, you rest before you actually put to bed, you'll be fine.
All right, thank you.
Right. Okay, ma'am. So any more questions? No? All right. So if there are no more questions, I'll say thank you for giving us your time and for listening, and hope we keep on being safe. I hope to meet you very soon one day when your babies come for delivery, and I wish you a nice time in pregnancy and safe delivery when the time comes. Okay. Thank you for joining. Thank you for listening. I will see you next antenatal class.
Thank
Thank
you
you,
very much.
doctor. Have a lovely
Thank
day.
you. All right. Bye.
Thank you.
All right. Thank you. Bye.
Thank you.